On Saturday afternoon, we will be talking about collaborations and ways that our organizations, namely HOPA, the Hematology Oncology Pharmacy Association, can collaborate with BOPA and some of the other international organizations that we are partnering with on education, stakeholder initiatives as well. So some of the collaborations that we've discussed in the past are there ways that we can cooperatively work together on education? Many of us, we are working in areas that cancer is global, as we know. The way we treat these patients is global, especially when we not only have national guidelines, but international guidelines and practice standards. So how can we all come together to optimize the care of the cancer patient? We feel as though that there are opportunities to come looking at the way we support our cancer patients through their treatments. Again, the chemotherapy-induced nausea and vomiting collaborative that we did with Elson and Eastside is an example. So are there ways that also BOPA could come in and look at helping us to enhance those materials, or could we look to BOPA and help them bring that type of an initiative to their providers here in the UK? So we think that there could be opportunities for us to work together, coming up with tools and resources that we can provide to both our memberships. There are some challenges, as you can expect. Some of the medications that we have in the United States are not available in the UK and vice versa, but at least you can talk globally on the approaches to the care of these patients and looking at ways to maximize the resources that are available to individuals within their own facilities. So that's something that's pretty exciting. Education-wise, of course, traveling and presenting at others' meetings is a great way to network, is a great way to come up with ideas, to try to initiate these projects. At the Hematology Oncology Pharmacy Association annual conference, which we hold in the spring, typically at the end of March or early April, we have opportunities for anyone to submit an abstract for a poster presentation. And that provides a wonderful forum for people to come and speak with their colleagues to learn not only what the other colleagues are doing to look at similar problems, but then they can then add to the conversation by saying, look, this is what we did at our institution and what worked and what didn't. So these forums, I think, are excellent. These meetings, such as the one here in Glasgow now, are great ways for all of us to come together to really have that conversation, to try to identify opportunities in the future. Of course, we do have some online webinars within HOPA that I think could be excellent opportunities for either presentation by other members or even co-presentation. Almost difficult patients. How can we treat those difficult patients and the challenging patients? If we were to present a patient case, for example, and give a perspective from someone in the United States, then offer someone from Canada the opportunity to describe how they would approach the situation or the patient issue, and then of course here in Europe. I think that'd be a wonderful way for us to collaborate and really help one another understand the best way or the optimal way to approach the care of cancer patients.